Hey guys, it's Dave. Today we're going to talk about shingles, which occurs with the reactivation of the chickenpox virus, which can lay dormant in your system for years and years and years. Literally, you can get it as a child when you're 2 years old and not have any problems, and then suddenly you turn 80 years old and something sets it off, and it comes out of dormancy and causes a rash, and it is shingles. It's very painful, it's itching, and it's a rash that will develop on one side of the body or on one side of the face. That's what differentiates it. For a lot of people go, well, is this a bug bite? What is this? Well, bug bites will occur everywhere. With shingles, you'll be located in one area, specifically on one side of the body or the other side of the body. Like chickenpox, they're little blisters that will pop up and occur that are red and raised, and they will be filled with a little liquid in there. They will scab over in 7 to 10 days. During that time, it itches like crazy, it's very painful, and you don't want to scratch it, because when you scratch it, you can open them up, which leads to more problems. The rash itself, after the blisters will crust over in 7 to 10 days, the rash tends to go away after about 2 to 4 weeks, depending on how severe the case is. Before the rash occurs, you may notice some pain in the area, some itching in the area, some tingling or nerve shooting sensations in the area. That's generally what's going to bring it on. When you get shingles, of course, you have the itching, the rash, the pain that I discussed, but you can also see fever, headache, nausea, vomiting, severe chills, and also you can develop a sensitivity to the light, where your eyes will be very sensitive to any bright light or the sunshine. If you do develop on the face, you want to be very careful and monitor it, because it can spread into the eye. If it does spread into the eye, get in to see your doctor or optometrist, ophthalmologist right away, because that is the one situation where you can have a severe side effect which can lead to vision loss. Most people, if you get shingles, will only get it once. However, it can be reoccurring, which is why if you get the shingles and you think, oh, I've had the shingles, I don't want to get the shot to help prevent it, it still is a good idea, because you don't want them to come back. And if you're one of those unlucky ones that can get it more than once, by all means, I recommend getting the vaccination so you don't have to deal with it again. If you have the shingles, it can be spread, just like chickenpox. It's not nearly as contagious as chickenpox. But if you do spread it, what individuals will get, they won't get shingles, but they will get chickenpox. So you want to be aware of that. Again, like chickenpox, it's not contagious once the rash has crusted over and the vesicles have actually broken or sealed up and scabbed. Then it's not contagious. So it's a good idea, if you have the shingles, by all means, to cover up with it. Make sure that it's not going to be a cloth that will stick to the vesicles, to the scabs, but something light, because that will be better for you as far as pain and itching as well. But you will want to stay away from unvaccinated individuals or pregnant women or infants or young children as well, because you can give them chickenpox. Now, the complications that you can see with chickenpox, like I said, you can see vision loss in the eyes, you can see skin infections. If you're scratching your arms really bad or wherever the rash may be, and you rupture those vesicles open, you can get a skin infection there, which is why it's very important not to be scratching, and I know it's very hard. One of the main things that you're going to see, though, is post-herpetic neuralgia, or nerve pain that occurs after shingles in that area or that side of the body. And when that occurs, it's going to not necessarily be there all the time, but it will flare up under certain situations. I've had patients that have had it flare up when the weather changes. I've had them change when they change in elevations, like going up into the mountains or going to the ocean. The change in the elevations will cause it to flare up. And of course, stress, being under tense situations, will also cause it to flare up. if you develop post-traumatic neuralgia, talk to your doctor or provider about looking at a prescription like Cymbalta or duloxetine or nortriptyline, or there is gabapentin or Lyrica as well, which can be used to help out with some of that pain that happens. Rarely, you can see pneumonia if you develop shingles, but that's a rare case, as well as issues with your hearing, as well as encephalitis, which encephalitis, if you get to that point, it's a hospital situation because it can lead to death. But again, those are rare situations. As far as triggering or risk for shingles, what can actually trigger it, the older you get, the more prone you're going to be. So as you get over the age of 50 and on up, you're going to be more prevalent to see shingles, as well as people that are immunocompromised. If you get an infection, if you would get COVID, if you would get the flu, if you would get pneumonia, anything like that, as well as going through cancer treatments, or if you have HIV, those are all going to affect your immune system and make you more prone to get shingles. That's why I always recommend a good multivitamin, as well as vitamin C and vitamin D if you have an infection, to help boost your immune system. Stress can also cause you to be more prone to get shingles because it's lowering your immune system. So be aware of that. There are certain medications that can make you more prone to be suspect to having shingles, such as corticosteroids like prednisone or methylprednisolone, or anti-rejection drugs like mycophenolic acid or tacrolimus, as well as many others. They can harm your immune system, making you more prone to get shingles. If you do get shingles and they're away from your face, some of the things that you can do to help self-treat. Number one, wear loose-fitting clothing, so it's not rubbing up against your skin, hurting it, making you more prone to itch. Try and avoid scratching at all costs, because that's what's going to actually make you more liable to have like a skin infection. Cool baths, especially oatmeal baths, can help out. Calamine lotion is soothing and can help out, but you do not want to use bacitracin or triple antibiotic ointment or any antibiotic ointment on the sores themselves. It's not going to help. It can actually make the situation worse. If you do cool compresses for like 20 minutes on, then 20 minutes off, that will also help. But don't do those after the sores have blistered and stop the oozing. Stop with the compresses. You can use Tylenol or ibuprofen, and that will help out with some of the pain. Again, I don't recommend Benadryl because of some of the side effects that occur with that. But for itching, if you wanted to take an Loratadine or Zyrtec or Allegra, that can help out with some of the itching. You can go to the doctor or your provider and get an antiviral like valcyclovir or acyclovir. If you do it within the first 3 days of actually feeling the rash come on or the rash developing, it will do better for you than if not. And that antiviral will generally run a week to 10 days. If you don't catch it within the first 3 days, it's not going to do near as much good for you. You may want to skip out on it altogether. The best thing that you can do, though, is prevent shingles. How do you do that? Get vaccinated for it. We did have Zostavax, which was a one and done shot. They've removed that from the market basically because we have a better alternative now. But for people who had Zostavax, the one and done shot, you may want to consider getting Shingrix as well. In fact, the CDC recommends that you do get Shingrix because Zostavax only had a 51% success rate as far as prevention. As far as post-traumatic neuralgia, or the pain that occurs afterwards, it was looking at about 67%. With the new one, with Shingrix, which is a 2-shot series, you get 1 shot and then 2 to 6 months later you get the follow-up or the second shot. I generally recommend 3 to 4 months in there. For prevention of shingles, In the 50 to 69-year-old population, you're looking at a 97% coverage on that. And that is not only for shingles, but also for postherpetic neuralgia. For the 70-year-old and older population, you're looking at a 91% prevention rate on that. So very, very good, especially when you compare it to the Zostavax. It's much better. Now, you can also get Shingrix if you're below the age of 50 and over the age of 19. So 19 to 49, you could still get Shingrix if you have a weakened immune system. So if you have organ transplantation, if you have going through chemo, if you have HIV, several other conditions, but your insurance may not pay for it. So you want to talk to your pharmacist and your provider if you qualify and if your insurance pays for it. But it still would be a good idea. Now, it is not a live vaccine, just so you're aware of that. If you've never had chickenpox, guess what? You don't need to worry about shingles. You can't get shingles if you've never had chickenpox. You can catch chickenpox at an older age, but you won't get shingles. However, even a mild case of chickenpox, which for me, I was in high school and had a very mild case. I had like 4 or 5 spots and that was it. Ran a little fever and it ran its course. You can get shingles. So do you want to take the risk of getting shingles, which is a very painful, very itching with serious consequences in the case of postherpetic neuralgia and the possibility of vision loss? Do you want to take that chance that maybe your doctor misdiagnosed you, or maybe mom and dad didn't even take you to the doctor when you were 2 to 10 years old because you had a couple of spots that they thought were bug bites? Because 90% of the population that's been estimated in the United States has had chickenpox. It's a good idea to take care of yourself and get vaccinated. It's the best prevention you can do.